This episode of the Dr Hilary Show is brought to you by Olbas Shower Gel, bringing the power to breathe right into your shower. A reminder again to subscribe to my free newsletter. Each week you'll receive 3 hacks to a healthier life and simple ways to improve your well-being, along with the latest medical advice, all straight from the show to your inbox. So just go to DrHilaryJones.com. Now, my guest today is a doctor who works tirelessly transforming women's health and longevity. Dr Anita Raja is an award-winning NHS GP, a leading voice on female health and menopause, and the CEO of House of Health in Birmingham. You'll recognise her from appearances on ITV, BBC and Sky News, where she's become a trusted voice on complex medical issues. Welcome, Anita. How are you?
I'm really well. Thank you so much for inviting me on your show today.
It's my very great pleasure. And you champion so many issues. We've just discussed them there in the intro. But if we were to choose any, would you have a favourite? Would it be longevity, women's health, or standing up for ethnic minorities?
It's difficult, isn't it? It's really difficult. And I think I've done so many things in the background that my husband has finally said to me, you need to stop. We need to stop somewhere. Because what is this, But I genuinely think that medicine is so vast. There's so much to learn. It's so interesting, so exciting. I'm sure there are things you're learning after so many years of being a GP every single day. It is, there's so many advances in medical science. There's so much new to learn. Longevity is a very new subject, especially within the national health, because I think as GPs, we are perhaps not given enough training around longevity. And, there are different names that are given to it, in different parts of the world. But it is a science whereby we're increasing health span of people. So it's not about living over 100 years, but it's about living healthily.
Absolutely.
And, it's very, very basic. It's basic science, very easy, but I guess implementation is the main challenge there. And it's about hormone optimization, sleep optimization. It is about lifestyle optimization, exercise, weight optimization. And in an era where we are now surrounded by GLP-1s, I think there's a lot of push to have people who are of a healthy weight and feel well in themselves.
So just to explain GLP-1s for anyone who's not medical, we're talking about Manjaro, Wegovy, Ozempic, all the fat loss injections, which have been sort of in the headlines almost every day for the last few months and possibly years. So the NHS would want people to live longer but healthier. They don't want them to live longer with complex medical issues. That creates bed blocking. That creates misery. If people live longer and they're not a burden to the NHS, great. People feel well into ripe old age. That's a good thing. So where would people start with that? In their youth, in their middle age, thinking about alcohol consumption, more exercise, weight? Where would you start?
I think you should start whilst you're young. But some of these people, unfortunately, have been introduced to the science of longevity much later on in life. So they're in their mid-40s, mid-50s now. There were no GLPs 10 years ago. So it's something fairly new. I would say it's never too late to start your journey. Start whenever you can. And it's very easy for us clinicians to tell our patients to go back home, try and lose some weight, get onto that treadmill, curtail having alcohol, stop smoking, things like that. But life is very unforgiving and not everyone can do that. And I am half South Asian, and I come from a ethnic minority background. And I feel that women from my culture have never been on a treadmill. And if I'm going to tell them as a clinician at the age of 50, please get on a treadmill, go back home, lose some weight, cut out on rice and, cut out on roti and cut out on all, they're simply not going to be able to follow those instructions. So they need a little bit more help.
Right. And what does that look like, that help? That
help is would look like a longer consultation than the 10 minutes we're given in the NHS.
Sure.
So 10 minutes are simply not enough. We need a comprehensive consultation where we can understand the lifestyle of this person, the genetic makeup of this person, because we now know, and there's enough evidence to suggest that if you are from a South Asian background, there's, you're at a higher risk of developing fatty liver disease because your genetics come from a time of famine, lack of food, lack of water, and your body likes to store fat.
It's the same with heart disease, right?
Exactly. The cardiovascular risk is higher in certain ethnic groups. So I think what we need to understand is that one size does not fit all. It's got to be a tailored program. And I think we need a lot of education amongst our colleagues around the different ways in which we should be managing our patients.
Well, it was Freddie Mercury who sang the song "Who Wants to Live Forever." Most people do, as long as they live well. So this idea that we can live into our 100, 110 years, of 120 years, people are talking about. Do you think that's possible? And do you think there are limitations?
I think anything is possible. I remember the time, because I personally am very passionate about obesity and weight loss and things like that. And I've actually done, I've gone on to do further education in weight loss, because I suffered from obesity most of my life. So I was an obese teenager, I was an obese child, and I know how it feels to live inside the body of someone who is overweight. And I would find it very difficult to lose weight. And at that time, I used to think, will there ever be this magic pill or medication that is actually going to help us lose weight? And would it ever come? And yes, now we've got GLP-1s. I'm not saying that they're, the answer to all of our problems, but it's a good start. And we initially used them for people who are diabetic to control their blood sugar levels. But we now know that it gives you the added benefit of, acquired weight loss that we do require for them to optimize their health. Because if a person loses 10% of their body weight, if they are suffering from a condition called polycystic ovarian syndrome, which is quite common, unfortunately, in women, that can go into remission. Your diabetes can go into remission. If you're suffering from high blood pressure, that can go into remission. So it's actually a great thing. If you were to ask me, what is the one thing that I would suggest as a first step in the right direction, I would say weight optimization.
Okay. How did you lose your weight?
Very good question. So I lost my weight way before GLP-1s were introduced. I was a yo-yo dieter. I have tried every single drug under the sky, whether it's weight loss pills, this, that, any sort of ad on the internet, in the newspaper, in a magazine, and I'd order that because I was desperate to lose weight. But the one thing that worked really well for me was the ketogenic diet. And I have been on one meal a day for the past 5 years. My son is 5 years of age. And when I had my son, I promised myself that I have to break the cycle of obesity. I have to turn my life around and stop worrying about being overweight. And that is when I went on the one meal a day. And I've been on that for the past 5 years. But I totally understand, again, as I say, how it feels to be inside the body of someone, inside the head of someone who's overweight, because there's this food noise that's there in the background all the time, and it's very difficult to break that cycle. But I was very lucky because my husband, he supported me through this journey, and we eat the same things. We don't buy. So the first thing I did was I stopped buying crisps and chocolates and things like that. So when we go in a food shop, it's always healthy stuff. And I try that my sons don't have unhealthy things as well, but it's very difficult because we have a very involved family that help us raise our boys, and they don't necessarily have the same food choices as we do.
There's still this culture, isn't there, where, you've got to provide food for people to make them feel sociable. You've got to be kind to them, have some food. It's always there. Plus the food noise. It is quite difficult to counter that. You talk about hormonal optimization. We have come a long way for women who will go through the menopause.
Oh, yes, thank God for that.
With HRT, and we are prescribing some of those women testosterone where it's appropriate. But it's very difficult to now translate that to look after men hormonally. So a lot of men have hypogonadism. Their testosterones are low. They feel fatigued. They don't have energy. They're losing muscle mass, and it's quite difficult to get testosterone on the NHS. Tell me about that.
So it's a very vital topic, and I'm very grateful that we're discussing this today, because it's not just hypogonadism that men suffer from. That is something very serious, and of course they would be referred to the endocrinologist and be under a specialist, hormone specialist, that's an endocrinologist in secondary care. But we've got men who are very young, they're overweight, they have poor sleeping patterns, they're using their screen till late night, and we now have evidence to suggest that if you are overweight, there's estronization, so you lose your testosterone. If you're using a blue light till late night, that is depleting you from your testosterone. And if you've got poor sleep, not good quality sleep, but by good quality sleep I mean at least 6 to 8 hours of sleep, which is uninterrupted through the night, then that could affect your testosterone levels. And we get so many young patients who come through the door and their main symptom is fatigue. Tiredness. They're tired all the time. And when we do offer them a full health screen, which includes their hormone levels, then sometimes we do pick on the fact that their hormones are just very low. The testosterone is very low. And then we do, of course, repeat that because the testosterone levels should be done first thing in the morning, fasted. If you're fasting and doing them, they're more accurate around sort of 8, 9 a.m. in the morning. And then we guide them through it. Now, not everyone needs to go on testosterone therapy. However, it's very important that we tell them that they need to lose weight, they need to have enough sleep at night, and they need to curtail the use of blue light. I mean, these screens they're finishing us off.
Yeah, absolutely. In all sorts of ways, not just sleep, but it's taking making us mindless, isn't it?
Yes, it certainly is. And I'm so worried about that because I remember when I was much younger, when I was doing my GCSEs or my A-levels, creative writing was a thing. And I remember that because my father is a writer, he's written many books, and I think I sort of inherited that from him. I used to write, and I remember taking my A-levels, and I got an A star when I did my A-levels, and I was a science student, but I had English literature as part of my A-levels because I just loved English so much. And then now when I look at the newer generation, I feel very sad, tremendously sad that, there's no effort whatsoever to even draft an email using, creativity. It's as if ChatGPT or all of these newer AIs are just, the go-to, which makes me sad.
Yeah. Really interesting. Well, we need to take a short break there so that I can tell you that this episode is supported by Olbas Shower Gel. The winter season is upon us, and whilst it brings those cosy evenings that we all look forward to, it also brings the inevitable winter sniffles, doesn't it? So whether you're hopping in the shower ahead of a busy morning or winding down after a long day, Olbas Shower Gel is a refreshing new format that delivers their signature scent. As the steam builds, the natural menthol vapours are gently released, creating an invigorating in-shower moment that uplifts the senses and leaves you feeling clearer and refreshed. And because it's dermatologically tested and suitable for sensitive skin, Olbas Shower Gel gives you a deep, luxurious cleanse without worrying about irritation. And as it's made with natural essential oils of eucalyptus and peppermint, it helps you feel refreshed, rebalanced, and ready to take on whatever the day or night throws at you. You can order Olbas Shower Gel now on amazon.co.uk. So when I'm very interested in the area of health inequality, we know that much of the messaging that you and I do all the time is not taken up by certain communities. How do we reach those communities that don't usually respond to the kind of health messaging that is in the media generally? You'd be very well placed to tell me this.
Yeah, so I speak a fair few languages, and that is by pure luck or coincidence. It's something that I didn't choose, but I guess nature choose for myself because I was born and bred in Germany. So German is my first language. My mom is Persian, so I speak Farsi. My dad is originally from Pakistan, so I speak Urdu, Hindi, Punjabi, and I can speak a bit of English as well. So I'm very well positioned geographically because I am from Birmingham, so I live in Birmingham. And in Birmingham, we have lots of ethnic minority groups. We've got people who speak Farsi, they speak Dari, which is, again, the native language of people from Afghanistan, and there's a crossover between Farsi and Dari, so I can speak both. So, and there's Urdu, Punjabi, Hindi. So I certainly feel that, it's immensely difficult to tap into these communities if we do not place ourselves in the community centers that they attend. So it would be extremely important for us to be part of, their, a part of their, their going to the gurdwaras, going to the mosques, going to the temples, and having these little community services where we're actually talking about health checks, the importance of health checks and things like that. Because what we see certainly in the ethnic minority groups, especially when it comes to diagnosis of breast cancer, there's a lot of shame and stigma to even talk about your breast. There's a lot of shame and and stigma to talk about your cervix. Most women don't even know what the cervix is anatomically, because it's something that a mother does not teach their daughter because they don't know about it themselves. Culturally, it's something that nobody wants to talk about. Periods still are considered a taboo. So you're talking about communities that, are ashamed of accepting their body the right way. They're ashamed of talking about sex. I mean, that is a big thing. Nobody talks about sex. It's and I guess, we are in the position of privilege to be able to emulate the right message in the right communities, and we try our best. But we would need to reach out to different community centers, and when it's Vaisakhi or they're having their different religious melas where lots of people come together, we've got to be there so we can spread the right message at the right time.
Is it getting better?
It is definitely getting better.
That's good to hear. So just going back to longevity for a moment, I know you would start obviously with various tests for people and talking to them about their lifestyle, examining them, looking at investigations that you've carried out, and then you would come up with a plan.
That's 100% what happens. So I work at the House of Health. I'm the CEO of the House of Health, which is a private healthcare group, and the way we have positioned ourselves is that we've got a bit of a pyramid. So we've got a consultant endocrinologist who sits at the top. Then we've got 2 GPs who have a special interest in hormone optimization, and then we've got dietitians. We've got a team of dietitians. Actually, we've got 3 of them. We've got personal trainers, and the whole idea is that we give you a full package, which essentially means that a patient comes in, gives us a history, we examine them, and then we offer them a blood test. And then if we have picked up that the testosterone levels, for instance, in a male are low, then we give them a full hormonal profiling to make sure that there is nothing else that is deranged. For instance, the prolactin, the progesterone, this and that. And then as long as everything's okay, then we would move on to offering them a replacement, which would be testosterone replacement. But everything is done MDT style, which essentially means that we have a chat with our endocrinologist and we say, look, this is the situation. This is what we're seeing. What would you recommend? Do you need to see them, or can we do this? And we work as a team. And that would be the next step. And we have people who come back and say, well, you've changed our lives. Because look, it would be great for us to prescribe them the testosterone, but that's not the only thing that is going to help someone who's morbidly obese, or somebody who has a background of diabetes, or a background of hypertension, or somebody who has a background of high cholesterol levels. So we need to cater to all of their needs and make a comprehensive management plan where we're actually saying, look, we can give you the testosterone replacement, but we will have to monitor your testosterone every 3 months, the testosterone levels every 3 months, and we advise that you lose some weight as well. And we would say that you do some exercise as well. And in some instances, we would be offering them GLP-1.
Yeah. So these are wraparound services that you're giving everybody. So this is really interesting, and unfortunately, it's not available on the NHS, not to that comprehensive degree anyway. And this is a bit of a frivolous question, but do you ever get people coming in and asking about cryogenics? When I get to a certain age, I know that there's nothing medicine can do for me. If I freeze my body like they're doing in America, will they be able to revive me in 100 years' time? Do you ever get people coming in and asking about that?
Not yet. We have not had this question yet, but I suspect that we might get this question soon. But I'd say, Dr. Hilary, I'm not someone who would believe in living forever. Personally, I think we need to make most of what we've got at hand, which is our lives, and give ourselves. I mean, you are a perfect example of someone who's really preserved and held on to youth for a long time. You look very well for your age.
Well, you're very kind.
No, and I mean it. Trust me, I have German upbringing. I'll say it as it is. Not very many people like it. In fact, when I qualified as a doctor and I moved to England in 2013, I had a huge cultural shock because I realized that over here nothing is said the way it is. Everything needs to be said in a roundabout fashion. So you have to beat about the bush. You need to, even if you're sending out emails, you need to write these 3 lines before you actually come to the point.
Are they more direct in Germany? Are they more sort of straight to the point?
Exactly.
Are they?
They're straight to the point, and nobody minds it.
Okay.
It's a cultural thing. You say it as
you know
it is. Yeah.
Okay. So let's talking about the difference between NHS and private care. We're seeing the growth of private general practice. I mean, in most towns now, there are more private general practices springing up. Is this because people are frustrated with accessibility to the NHS, do you think, or do you think there's a demand for longer consultations, for a feeling that you're getting more comprehensive care? But certainly it's changing. But of course, it's helping people who are wealthy rather than people who can't afford it.
That really makes me sad. But we have a way around it, because when it comes to the organization that I run, which is House of Health, we have kept our pricing very fair. And you'd be delighted to know that we are 1 year old now. We turned one on the 1st of October. And most of our patients, I want to say 98% of our patients, are people who are normal wages and can actually afford accessing care through private means. And yes, of course, there's going to be a bit of a disparity between people who can afford it and cannot afford it. But we try our best to give everyone a very fair deal. We've got options where you can pay in 3, you can pay through Klarna, you can go on payment plans and things, because we really want this type of premium healthcare, because we're 5-star on Google, to be accessible to everyone. And when it comes to why people are moving towards private healthcare, it is a bit of both, because yes, they want a longer consultation, and also they can no longer wait for weeks on end before they can actually access care.
And I think it's a matter of the perception of priority. I think a growing number of people are saying, actually, my health is more important than so many other things, and it's something that I am prepared to pay for. That's changing, because there was a time when people thought, well, the NHS can provide everything. And back in 1948, very few people could afford private care. And that's why the NHS was brought into being by that socialist government. And suddenly it was available to all at the point of need, which was great. But now it tries to do too much, I think. And people are waiting for their operations for a very long time, or even waiting for a GP consultation. I remember when I first started in general practice, that if I didn't see my patients on the same day they wanted to be seen, I felt negligent. But now people are waiting 3 weeks, 4 weeks with red flag symptoms. And so the quality of care has dropped. Does this worry you? It
does worry me, but the thing that worries me the most is that, the future of the NHS, which is our younger workforce, is extremely demoralized. This is our next generation. These are our future doctors. These people are going to carry the NHS on their shoulders, but unfortunately they're demoralized. I worry about a brain drain. 1,000 doctors immigrated to Australia in 2022 alone. And at the moment, if you look at the junior doctor strikes, I mean, they're happening in the background. It's extremely unfair, because I think in this country, there's no value for the skill that doctors have. And what we are failing to understand is that these are highly skilled individuals. There's a big market for them. If you're not going to value them, they're going to leave.
Well, I completely agree with you. I mean, I wish they wouldn't talk about percentage increase in pay that they want, because a percentage of not very much is not very much. If we looked at what they're worth, I think that would be a different conversation. It's unfortunate that they feel that they need to strike. I don't think I ever went on strike. I don't think there was ever a call for doctors to go on strike. But you're right, they are emigrating. If they have that opportunity. And I know that a third of some medical school graduates never practice medicine. They look at the job and say, oh, actually, it's not for me. But we've spent a lot of money training them. And I've spoken to health secretaries in the past and say, why don't we have a short service commission at least, so that they do 3, 5, 10 years, pay back some of their training before they leave. It's never happened. I suppose that's democracy for you. People can choose the career they want. But, we do have an issue and the NHS needs to address urgently.
Because my worry, Dr. Hilary, is that this is going to get worse. We're unable to see consultants, but if there are going to be no consultants to see you, that's going to be worse. And I think there's a push to replace GPs with other allied healthcare professionals, and consultant doctors with other healthcare professionals. But what we're failing to understand is that the quality of care, I'm not saying that we're the best, but, keeping in mind the amount of years and the rigorous training that goes behind making a consultant doctor or for a GP is not comparable to any other allied healthcare professional. And of course, the sort of expertise that they have to manage risk and also manage the side effects of anything prescribed, I mean, that's unmatched. How can we replace them with other healthcare professionals who are not doctors? So, I mean, I think I'm very clear about what I think in terms of what the future of the NHS is, because I'm really worried that with the demoralized workforce that has spent hundreds of thousands of pounds, which is no longer subsidized education, they don't get, a free accommodation anymore. I mean, there was a time when, medical school would cost £1,000 a year, and now it's gone up to 10,000 a year. So, there's a lot of, I think loads of these people take lots of loans, and a lot of these doctors don't want to stay anymore. And that is my worry. So I think I'm hoping that, we overcome this crisis, which would be a big blow on the NHS if we don't.
Big question now. Would you encourage your sons to go into medicine today?
I don't think so.
Okay.
Which is very sad. I mean, my husband definitely is very, very sure that he does not. He discourages my son. So my son, who is 12, 13 years of age, definitely feels that medicine is the right choice for him. He loves my line of work, so he thinks that being a GP is great. I guess this is what he's perceiving from the way I come home, and there are lots of interesting cases. I probably enjoy my work, and he sees that. But my husband, he's dead against the idea. He's a hospital consultant. He's a gastroenterologist and he's a liver consultant. And he's done a PhD in medicine as well. So he's a PhD as a doctor. But he's dead against the idea. And he thinks that, they should do anything but medicine.
So they're into the ideal of it and you into the reality of it. And I quite understand that, because I have 5 children, but only one who is a doctor.
Yeah.
And he when he told me that he was thinking of converting to a medical course, I was actually ambivalent. I said, well, that's great, but you are aware of the downside of that career. As it happens, he's very well suited to it and he loves it, but it's hard.
It's hard.
It's not it's not for everybody. So I completely understand that. And I know it's a difficult question. We came through a pandemic not so long ago, which was probably the most serious pandemic globally since the Spanish flu of 1918. And now we've got the COVID-19 inquiry. And, it's been pretty vicious to those people who were in government and some of the medical advice that they were getting. Do you feel that we did such a bad job in this country during COVID compared to other countries? Because nobody got it quite right in all aspects. I mean, we came out with the vaccines first. We were probably too slow to bring lockdown in on 1 or 2 occasions, and we could have done better. But I mean, what do you feel about how we dealt with it, and how do you think we'd deal with it again if another pandemic came our way?
Well, I'll tell you a very interesting thing. So during the pandemic, I was pregnant with my 5-year-old son, and it was a high-risk pregnancy because I'd had numerous miscarriages before, one at 20 weeks before I fell pregnant with my son, Rumi, who's 5 years of age now. So I was a healthcare worker. I was working full-time within the NHS. I work in the NHS part-time now. And at that time, I felt as an NHS worker that I was given minimal protection because there was the lack of knowledge and understanding around COVID-19 was the biggest hurdle. There was lack of PPE. In fact, there was no PPE in a GP surgery. We were still doing nursing home visits. We were still, allowing patients to come to their GP surgeries. And I was high risk at that time. So I think I was pretty traumatized. I was in work. I didn't take a single day off. I worked, I think, 6 days before my son was delivered, and wow. I was a full-time GP at that time. And I feel that my husband, who was deployed to ITU, he was a trainee doctor around that time. He was working in ITU, was coming home, and we had this little ritual that he would follow, where he'd come back, drop his clothes, in the garage, take a shower, and then come and meet us, because he'd be worried that it would bring me and the unborn baby to harm. I mean, when it comes to protection of healthcare professionals, I think there's absolutely no doubt that the protection was simply not there, not enough. But you're absolutely right. I don't think anybody got it right. And and we were just one of many. We tried our best. I was over the moon when the COVID-19 vaccine was introduced, and being a healthcare professional, we were offered the vaccine much sooner and much quicker than the rest of the world. And I think we've got to give them, we definitely need to give them this. I mean, they did well when it came to that. And I was part of the vaccine administration team as well. So we were administering it in GP surgeries, community centers, mosques, you name it. And we were giving the vaccine out to different patients. So I guess, yes, it's a bit of both.
I think the thing that shocked me most during that time was the lack of trust, not just in politicians, which I kind of understand, but in science, in medicine, in doctors, that lack of trust and the growth of misinformation in those echo bubbles that people are in social media. If you talk enough about misinformation, it becomes their truth, and that's a worry. We were talking about social media and smartphones and too much blue light and ChatGPT earlier, and it's a worry that there is so much misinformation that is difficult to break down when there is that lack of trust. But talking to you, I hope that people say, well, look, you were so dedicated during your pregnancy. You worked 6 days before the birth, and you knew that you were exposed with lack of PPE. You're doing great things, and it's been wonderful talking to you. So keep up the good work. And I should probably let you get back on that train to Birmingham and back to the clinic, shouldn't I? Thank you,
Dr. Hilary, for inviting me on your show. It was a complete, it was so delightful to see you.
It's been a thrill. Thank you so much, and keep up the good work.
Thank you.
My thanks to Anita. You can watch all my interviews on the Dr. Hilary Show YouTube channel, including my recent conversation with Antonia and Jack Calmado.
She came through the door, and I'll never forget it. It's one of my abiding memories, is she shouted "Daddy," because I had to work downstairs at the time. And she came through the door and she wanted to be on or with both of us. I was actually still working and, interestingly, about to go to my first conference in my new job the next morning. So I was pretty busy and pretty stressed with stuff. But, I had her on my lap on a Teams call with all of my team. They'd never seen her before. So strange that they saw her the night before this all happened. But yeah, she was super needy. She was warm. She was
grisly.
very grisly. But then she had a moment of absolute madness and was dancing and singing and having a great time. And we put her to bed as we would normally. And you put her to bed. I gave her a kiss, said goodnight, went and cooked dinner for us both. And we thought nothing of it. Yeah. And then, come the middle of the night, 3 o'clock in the morning, our lives were turned upside down, and within essentially 2-3 days she had gone.
Now, before you go, for the latest health news delivered straight to your inbox each week, subscribe to my newsletter at DrHilaryJones.com. We'll keep the conversation going about your health, your well-being, and what truly matters to you.